Hey guys, what is up? Welcome to my channel. Today we are going to be doing a little bit of a sit down video because at the time of me filming, I am 21 and a half weeks pregnant, which means I just recently surpassed the halfway point. And I know you guys have some questions, especially because 20 weeks is a really big point in your pregnancy. You have to do something called the anatomy scan. I believe it is also referred to as an anomaly scan as well. The words are interchangeable. It means the same thing. For the sake of this video, I'm going to call it the anatomy scan. That's because that's what I know it as. I definitely think it's important to talk about because it is probably the most important ultrasound and scan you are going to have in your pregnancy. Again, at the time of me filming this video, you would have seen me go twice already for my anatomy scan. I do have to go back a third time in 2 days time, and that just goes to show how important getting the photos and details and everything from this anatomy scan is. So I want to sit down, I want to chat about it, I want to tell you guys what it is. If you are a first-time mom like me, you probably have so many questions, and I did get a few questions which I'm going to answer through this video. I love that I'm kind of like the guinea pig for you guys because obviously first-time mom, don't know what the heck I'm doing. I am learning as I go and I am sharing as I go. This is my little babe. I got these photos from my anatomy scan and he is just so perfect. I love him. Now, where we begin, I think we should talk about what the scan is. Now, a lot of people know of the anatomy scan because of the name anatomy. It's when you typically find out the gender. In my situation, I did the NIPT, which is the non-invasive prenatal testing. It is a blood test that is performed to look for markers for genetic issues. And because it does look for chromosomes in the blood, you also do get to find out the gender. So my husband and I have known since week 13 that we were having a boy. Of course, like 30 minutes in, she goes, "Okay, so you're having a boy, right?" And I was like, "Yes." So that is a huge thing with the anatomy scan, is you find out gender. But what is even more important than that is this scan is probably, if not the most important scan you're gonna get, and it is the most detailed scan you're gonna get because the ultrasound tech is looking at your baby from head to literal toe. They are checking the brain, the heart, the stomach, the kidneys, the legs, the feet, the arms, the hands, the spine, the butt. So it is quite literally the most detailed medical check you are gonna get of your baby throughout your pregnancy. The overall goal is to get a full picture of your baby's development, of your own uterus, of your placenta, and the amniotic fluid. Usually at the anatomy scan is when you find out if you have an anterior or a posterior placenta, I believe it's called. So when you have a posterior placenta, the placenta is attached to the back wall of your uterus, so you are likely to feel more kicks and probably earlier on. People who have the opposite, when they have an anterior placenta, I believe that means the placenta's at the front, so that's why they don't maybe feel kicks as much, or when they do start feeling them, it's a lot later than people maybe with a posterior placenta. At the anatomy scan, they are taking a crap ton of photos of literally every inch of your baby. They're also taking a crap ton of measurements, and they're looking at the symmetry of the baby. So they're making sure like the nose is, you know, in line with the mouth and so on and so forth. With all of these details, they can try and rule out any abnormalities that your baby might be born with. For example, they spend a lot of time looking at the heart. They want to make sure that there's the 4 chambers of the heart, that the blood is flowing correctly, that you can see the pulmonary arch, you can see the valves and the aorta, and then that way they can kind of rule out congenital heart conditions. And then on the flip side, they also do try to spend a lot of time on the spine. Mainly they're looking at like alignment of the vertebrae because again, they want to try and rule things out like Down syndrome or a spine condition called spina bifida. With the anatomy scan, because it is so detailed, you do need a cooperative baby. First anatomy scan I went to was at 7 a.m. and baby boy was so very sleepy. He was super curled up and I was having a hard hard time trying to get him to move. Like, I was walking around the clinic, I was like doing squats and just like anything I could to try and get him to move, and he wouldn't. So they weren't able to get a full picture of what they needed. They weren't able to get his legs, his feet, good images of his spine, back, and his kidneys. The second time he was a little bit more cooperative, and I'll tell you why, because I do have some tips for you, which we'll talk about at the end. They were able to get his feet, his legs, his upper back and spine. We were able to see his lower back, spine, butt, and kidneys, but he started to kind of curl up again, so she wasn't able to get clear enough photos, and that's why I need to go a third time. Now we're gonna move into the second question. I kind of already touched on it, but when is the anatomy scan? I know you can do it within a range of like 18 to 22 weeks, but as far as I know and what I've been told, they like to do it closer to 20 weeks. I believe my first one was 19 weeks 4 days, and then my second one was like 20 weeks 1 day or 2 days, and when I go back for the third one I will be 20 weeks 4 days. Thirdly, who is doing this anatomy scan? So this kind of goes in hand with one of the questions I got, which was, do they tell you the results right away? First and foremost, I feel like this kind of depends where you live and just based on your clinic. So you're going to be doing the scan with an ultrasound tech. Now, whether you're going to be doing it with your OB's clinic or a random ultrasound clinic, again, that just depends on where you are and your OB. So for example, my OB, she actually does not do ultrasounds at her clinic. So she did refer me to an ultrasound clinic that her clinic highly uses and recommends, which is not far from her. So for me personally, I am doing my anatomy scan somewhere else, and they are sending my OB the results, which means the ultrasound tech is not allowed to tell me anything. She showed me baby, she showed me all of his like organs and everything, but because she doesn't work for my OB, she is not allowed to give me information. In general, ultrasound techs are not allowed to give you information because they can't give like diagnoses. They just see what they see, they send it off to the OB, and then the OB is who you're supposed to talk with. Now I'm meeting with my OB tomorrow, which kind of sucks for me because I'm not going to have the third anatomy scan done. So we're only going to be able to go over the results of my 2 anatomy scans thus far. Now on the flip side, if your OB clinic does do ultrasounds there, you should be able to find out the results right away. Again, not from the ultrasound tech. The doctor would come in after your anatomy scan and tell you the results. I'm honestly not sure. You guys can let me know in the comments, but from what I've kind of gathered is in Canada, it seems like a lot of the times, or a lot of the OBs actually don't do ultrasounds at their clinic. So what I'm hearing is a lot of Canadians have to do the same procedure and steps as me. They go to another place and then they have to wait for the results when they meet their OB. But all of the US, girlies that I follow, they are finding out their anatomy scan results the same day because their OB clinic does the ultrasound and they meet with the OB right away to get the results. Again, I don't know if it's like a difference between Canada and the US. That is just something that I've noticed. I guess it's kind of important to talk about what you need to know for the scan. I had a lot of people saying that theirs was coming up and what advice or what I could tell them. For me, we did both an abdominal ultrasound as well as a transvaginal ultrasound. So I had to drink 1 liter of water 1 hour before both of my appointments. And when I got in, the first thing she looked at was the abdominal ultrasound. So that's why you have to have a full belly. Both times I did my scan and they got the photos they needed with the abdominal ultrasound. They let me go release in the washroom and then I came back and did the transvaginal ultrasound. I would suggest wearing comfy clothes. Obviously you're going to an ultrasound, you're gonna have to, put your pants down for the belly and then obviously take them off when you do the transvaginal one. So just go comfy. Now, one thing I actually learned between my first anatomy scan and the recall, baby boy, like I mentioned, was very sleepy in my first one. So they actually told me to come in and drink something sugary before. Specifically, she had mentioned orange juice. So that is what I did the second time. And that definitely helped. I drank it about 20-25 minutes before my appointment. And I was literally waiting in the waiting room and he was kicking me. So I was like, okay, this is great. He is moving. So that's why when I first went in and she did the abdominal ultrasound again, she was able to get all of the photos of like his legs and his feet because he was like moving around and grooving. But then after some time, the sugar kind of started to wear off and he kind of started getting sleepy and curling up again. So going into my third time, I can't believe I have to go for a third time. I'm actually gonna do the orange juice again, but I think I'm gonna do it 5 or 10 minutes before. As I am waiting in the waiting room, I am just gonna chug the orange juice. Some people have also told me having like sour candy, sugary candy, chocolate, something like that beforehand also helps baby move. Now you may not have that problem, but some people actually that I've talked to have the opposite problem where their baby moves way too much and the ultrasound tech can't get photos. It's definitely a hit or miss. Hopefully to kind of give you a peace of mind, the ultrasound tech, the first time I went, she told me that usually people on average have to go back like 3 or 4 times for this. So if you do, don't feel bad. Kind of take it as like a bittersweet thing. Yes, it might be a little bit annoying that you have to keep going back for appointments, but at the end of the day, you're getting to see your baby more often, and you know what? I'm not going to complain about that. I think overall I kind of covered the gist of what the anatomy scan is and what you can expect. So I want to answer a few questions that I did get. The first is there anything that surprised you and how long did the scan take? I combined these 2 questions together simply for the fact because I was so surprised at how long the anatomy scan took. Both times I went, I was there for a full hour. I think maybe even a little bit longer. I think the first time I was there for an hour, 5 minutes. I guess maybe in my case, because baby boy was a little bit uncooperative, maybe that's why it went a little bit longer. But at the end of the day, they are trying to get so much detail, measurements, photos, everything of your baby. This is, like I said, the most important scans. It is going to take time. So make sure that when you're booking this appointment, you are keeping that in the back of your head. Somebody asked, how is chugging water before your ultrasound? That's a funny one. I am honestly used to it. This is an IVF pregnancy, so the amount of ultrasounds that I have had to do over the last like 6 months is absolutely insane. Just going back to when I was on stims, I was pretty much having an ultrasound every other day. Yeah, I've had a lot of ultrasounds through this IVF pregnancy and IVF journey, so I'm definitely used to it because the anatomy scan is so long. Honestly, at one point I was like, girl, I'm gonna pee on you soon, because like she was pressing down trying to get all of the images and I was like, just breathe, girl, just breathe. I think the first time it was about like 35 minutes of a full bladder and her pressing down that I had to hold before she let me release. So again, just prepare for that. Not necessarily an anatomy scan related question, but just like a timing question. Someone said, what does it feel like at this point in pregnancy? Is it just like bloating? And the answer is actually no. The first trimester, it feels like bloating, yes. Right now, it feels like, yeah, there's a baby in there. My belly is really starting to grow. It's honestly very strange. You feel that your body is shifting and stretching, not like in a crazy weird way. I would say I feel more full than I feel bloated. Overall, I still feel pretty good. I am starting to get a little bit of round ligament pain around like my hips and like a little bit in like my pelvic area, but nothing like too bad yet. Honestly, this point of pregnancy feels very surreal still. It's a lot different than like the first trimester because you see like 2 pink lines, but you don't really have like a belly to show for it, and now I have like a full-on belly and I'm like, oh, like there's a baby in there. Somebody also asked, are you dealing with back pain and how are you helping it? This is actually such a good question. Yes, I have been dealing with a little bit of back pain, but I had a little bit of lower back issues pre-pregnancy, so I was definitely expecting it. I did fertility acupuncture, of course, during my IVF journey, but I also did some acupuncture pre-pregnancy for my back issues. I would say like weeks 18 and 19, my back pain was pretty bad, but the last 2 weeks it's actually been feeling better. I've been managing it with stretching a lot more. I'm doing daily stretching and daily pelvic floor exercises. I've also been trying to keep up with pregnancy safe core workouts. I'm doing them usually like 2 or 3 times a week, just for literally like 5 minutes. That's all you need. And then another thing is, I've talked about it in a few of my vlogs, but I did start prenatal yoga. I did yoga pre-pregnancy and it helped so much with my back issues, and since I've been doing that consistently now, I've been going twice a week for the past I want to say 4 weeks now, and that has definitely helped my back pain. We do so much stretching and it just feels so good. I do also have a pregnancy pillow, as you can see right there. One of my girlfriends, Shauna, gave it to me, and I use that at nighttime. I put it in between my legs because during pregnancy, especially in second and third trimester, you do need to sleep on your side. I'm normally a side sleeper, so this hasn't been a huge adjustment, but now that I'm starting like to gain weight and the belly's starting to get bigger, I'm noticing that I wake up with some back pain. I guess maybe just like the stiffness of being in the same position. So I try throughout the night to flip like on my left side and my right side, and I've been finding that's been helping as well. I think that's pretty much all I wanted to cover for this. Obviously in real time, I don't know the results of my anatomy scan yet. I'm gonna be finding out tomorrow, and then again in 2 days time I have the third one. So I'm still feeling a little bit nervous, but overall I feel really good just because I've seen baby and to me things look good. I don't know. So I'm just trying to stay hopeful. Of course, in my upcoming vlogs, I will let you guys know exactly what my OB says. If anything is wrong, if everything is good, I will of course share that with you guys. If you have any more questions at all, feel free to DM me on Instagram or comment them down below. I hope you did find this helpful. Make sure to subscribe to me down below if you aren't already. Give this video a big thumbs up, and I will catch you guys next week for my 21-week vlog.